Hello and welcome to Rise Unwind. My name is Dan. You know, each and every week we try to talk to people from across the country about things you could do in your neighborhood. And on this week's show, we got this.
So excited to be down in Florida. I know the locals think it's cold, but we would swim in this weather. So we're glad to be down here.
One of the things that women told us, 41% feel the pressure to be a perfect parent.
All of that and more right here on Rise and Unwind. A lot of us think of cancer as one diagnosis and one clear path forward. But for many people, that's not really how it works. Multiple myeloma is a blood cancer that often comes back, forcing patients to adjust again and again. Today, Dave, who was diagnosed with multiple myeloma in 2018, and Dr. Robert Rifkin, a hematologist oncologist with the UCHealth system, are here to talk about it. Thank you both for being here, my friends. How are you?
Thank you for having us, Dan. We're delighted to be here on behalf of GSK.
Dave, your diagnosis came after a broken leg, something most people wouldn't connect to cancer. How did that moment flip your world?
Oh, it was dramatic, and it's interesting to think about the fact that in my case it began with a simple routine visit to my primary care provider, where when blood was drawn, they discovered I was very, very anemic, and that led to them scheduling an appointment with a local doctor who specialized in this area at a cancer hospital in Boston, which is close to where I live. And I was then waiting for additional blood work to be looked at from that visit to the oncologist. And while I was waiting, I was leaving work and stopped in the men's room, and I slipped on the floor and I broke my femur, and I did damage to my hip. And while I was waiting in the hospital for surgery to be done, I was informed that I did have multiple myeloma, and it was something that I'd never heard of before. I had no idea what it was. So the surgery proceeded, and I went back to see the oncologist, and he told me I had a very aggressive form of the disease, and my treatment began that very afternoon. And so all of this unfolded in just a 5 or 6 day period.
And when treatment works and then stops working, that seems like a tough emotional cycle. How have you learned to live inside that uncertainty?
Well, Dan, you're right. It's very, very difficult. I've been on this journey for a little over 7 years, and I've been fortunate to have a series of remissions, but I've also had several relapses. And every time you have a relapse, I would say my feelings were you're disappointed, you're disillusioned, discouraged, and you're also very scared because the treatment you're under no longer works. And you have to very rapidly find a new treatment that does work for you. But it's important to keep a positive attitude and to be open to having these conversations with your healthcare team and the professionals you're working with. And in my case, if you go back 7 years from the time I was initially diagnosed, my wife and I truly thought our lives were essentially over and we wouldn't be able to do any of the things we like to do. And that hasn't been the case at all. You know, as an example, we like to travel. We were able to go out of state a few years ago to our middle son's wedding. This past fall, we went to Italy, visited some towns on a bit of a cooking and eating tour. And we even visited an island the end of last year with our adult boys and our daughter-in-law, and we're dog lovers. We adopted a dog a couple years ago. So I mention all this because we have been able to do many of the things that we love, and our lives have maintained a high level of normalcy.
And Dr. Rifkin, why does multiple myeloma so often become resistant to treatment over time?
Well, I think the myeloma cells become educated, if you will, and then they become resistant. They learn how to metabolize drugs very quickly. But excitingly, we have a new drug, Blenrep, when given in combination with bortezomib and dexamethasone, is approved by the FDA to treat patients just like Dave, whose myeloma has come back or didn't respond. Importantly, as you pick a new treatment, with all medications, you need to talk to your doctor and team about any of your other medical conditions and any side effects. Blenrep can cause decreased vision, and this is common and can be severe. So anybody taking Blenrep will need to see an eye care professional before each dose. But this is really exciting because it's available in the community and it produces deep and durable responses.
And with these newer treatment options now available, how does that change the conversations you're having with patients about what's coming next?
Well, I think it becomes a much more hopeful combination and conversation. When I started, the median survival was 1.5 years. Now it's over 7 years, and we have many 20-year plus survivors. So I think more than ever, it's an optimistic message, and we encourage patients and their care team to get really well educated. You can go to the Multiple Myeloma Research Foundation or International Myeloma Foundation websites, and there's great patient-facing educational materials. You can then pick something that's safe, effective, and convenient for the patient and their team.
And if somebody wants to understand this disease better or prepare for a conversation with their doctor, where should they go for trusted information?
They should go to the Multiple Myeloma Research Foundation or the International Myeloma Foundation. But importantly, their healthcare professional will have a lot of educational material, and it really becomes a great team effort so that you can be optimistic even in the event that you relapse.
Dr. Rifkin, Dave, I want to thank you too for joining me today.
Thank you for having us, Dan.
Yeah, thank you.
Do you ever notice how a big sports moment can suddenly put an entire university in the spotlight? Indiana University is having one of those moments right now. Their football program is headed to the national championship for the first time ever, and it's shining a light on what's happening across the campus too. So joining us from Miami is Jeremy Gray, Senior Associate Athletic Director at Indiana University. Welcome to the show, Jeremy. How are you?
I'm doing great. So excited to be down in Florida. I know the locals think it's cold, but we would swim in this weather. So we're glad to be down here.
And this season has been described as historic for Indiana football. From your perspective, what makes this run so significant for the program?
Well, I have to come to you with total humility. Prior to this season, Indiana was the losingest program in major college football, and now they have a chance to be the first 16-0 team since the 19th century. So it's been a remarkable turnaround. It's the stuff of movies, quite frankly. And we've got a Heisman Trophy winning quarterback, the National Coach of the Year, Big Ten champion, Rose Bowl champion, Peach Bowl champion, and one win away from a national championship. So it's been a remarkable transformation.
And when a moment like this happens on the field, how does that energy carry over to the rest of the campus? You know, like the students, the faculty, even prospective students.
Yeah, applications are through the roof. Over 60% increase in applications since 2021. A lot of that has to do with great degree programs, the town and the campus itself. But football has added quite a bit to that with the exposure and eyeballs that have been on it. 28 million people tuned in to watch the Rose Bowl. So it's been a remarkable spotlight on the campus. And if you're talking about student life, they were lined up in Bloomington at 3:00 in the morning to get into the bars and pubs on campus in order to have a good viewing area to watch the game. We opened up our basketball arena, which seats 17,000 to the general public. And all 17,000 tickets were claimed within 90 minutes of going online. So, yeah, the town is ablaze with Indiana Fire.
And a lot of universities are facing flat or maybe some declining enrollment. What do you think Indiana is doing differently that's helping it grow at a time when others tend to be struggling?
Well, it's a confluence of events. One, there's the great established history and tradition of Indiana as an academic institution, a top 10 business school, maybe the best music school in the world, an incredible public affairs program, strengths in the sciences and the humanities as well. We've been noted for innovation. It's also an affordable option by comparison to a lot of the other peer institutions that are ranked in the top 10 in all of these programs. Then you add the athletic success to it. And we have the largest alumni base in the country at over 805,000 living alumni. So I think you put all of that together and the timing is right. And IU is becoming the first choice of a lot of prospective students across the country.
And I heard about your alumni network. It's like one of the biggest in the country. How does that community factor in the university success and opportunities for some of the future students?
No matter where you go in the world, you'll run into an Indiana University graduate with 805,000 of them. Obviously, they've become a very valuable donor network, both to the athletic department, but to the campus more broadly. And, you know, they're prospective employers, too. So That network really helps our undergraduate and graduate students find meaningful careers after they graduate. I think all of that together, and Indiana has become a very special place.
All right, Jeremy, for those out there that want to learn more about Indiana University, whether it's academics, athletics, or maybe some of the campus life, where should they go for more information?
You need to come to our campus website. If you want to learn more about athletics, go to iuhoosiers.com. All sorts of material available out there, over 500 degree programs. It's a great place. Come to Indiana, beautiful college town, amazing programs, and we'll see you on campus.
Hey, I want to thank you for joining me today.
Hey, thanks so much for having me.
Do you ever wonder if you're doing enough for your pet, or if you're only going to the vet when something is clearly wrong? New research says a lot of pet parents wait until a pet is sick or in pain, and plenty are turning to social media or AI for advice. Joining us live from VMX 2026 in Orlando, we've got Gene O'Neill, CEO of North American Veterinary Community, and Dr. Dana Varble, Chief Veterinary Officer at NAVC. Great to have you two here. How are you?
Oh,
it's good to be here.
Thanks for having us.
It's great to have you too. For people who haven't heard of it, what is NAVC and what is VMX, and why does it matter that vets are all in one place this week?
Sure. So NAVC stands for North American Veterinary Community. And right now, our biggest product that we have is VMX. VMX is what we are doing here today. We're sitting on the floor of the Orange County Convention Center, paying attention to 30,000 of our closest friends from veterinary healthcare teams from around the world, representing 85 different countries, to learn more about the latest diagnostic services, the latest methodologies, the latest products that are going to help them take care of your pets to live longer, healthier, happier lives.
So what feels new or different at VMX 2026 compared to past years, and what are vets most focused on right now?
So right now, as you can imagine, AI is big in every field. It's different in the veterinary field as well. We have over 750 exhibitors here paying attention to these individuals that are coming to display their best products and best services. As fast as human medicine is changing, that's as fast as veterinary medicine is changing too. So it's important for the veterinarian to maintain that cutting edge practice that they need to have to take care of every pet parent's dream.
And you guys are using this term health span and not just lifespan. What does that mean for a family at home with a dog or a cat?
Yeah, so like Gunderson here, it's not just enough that our pets live longer, right? We also want to be healthier throughout their lives. So there's so many growing areas of veterinary medicine, particularly areas like canine sports medicine, that are focused on things like movement, strength conditioning, and even reducing joint pain as a pet ages so they can stay active throughout their lives, especially in those later years.
That research is eye-opening. Many pet parents wait till something is wrong, and a lot of them are getting advice online. So what is the risk there, and what does a good vet-team relationship look like before there is a problem?
Yes, that's another area we're focused on here at VMX. We really want to emphasize and start communicating the value around preventative care more. We know that if we can stay on top of diseases, if we can use some of these new technologies to catch things earlier, that we have so many more treatment options. So things like nutrition or medication or even simple lifestyle changes can really help our pets live longer. And we want you to have a great relationship with your veterinary team. Again, whether it's your veterinarian or your veterinary technician, really give them a call, communicate with them, get their expert advice.
And if a family wants to start doing prevention the right way, what are a few early steps that make the biggest difference?
Yeah, probably the biggest difference is just keeping those annual wellness exams, making sure you're getting your puppy care here like Gunderson's ready to go get, and just again, giving your vet a call whenever you have a question or concern. We're really here for you. We're dying to have a great relationship with you.
All right, so where can my viewers go to learn more about the NAVC and VMX?
Sure. To learn about anything we do here to educate those in the veterinary healthcare space, visit us at abc.com. But as Dr. Dana Varble has said, talk to your veterinarian and don't be afraid to ask them questions about how they maintain their cutting-edge disciplines in their clinics and hospitals. Where do they go to get their education?
Gene, Dr. Varble, thank you too for joining me today.
Thank you.
Thank you.
Do you ever feel like the holidays are over, but you're still the one keeping everything in your head? There's new survey data that puts real numbers on that default parent pressure and what it's doing to moms with stress and burnout. So joining us is Wendy Noggle, USA Today Network Executive Editor of Entertainment, with takeaways from a new USA Today Peacock survey and some simple ways family can start sharing the mental load a little more. Welcome to the show, Wendy. How are you, my friend?
Good to see you. Thanks for having me.
All right, for anyone who's hearing mental load and thinking, wait, what does that actually mean? How do you explain it in real life terms?
So that is everything that basically keeps the household running. All of that to-do list of, permission slips, lunch boxes being packed, where are the hats and gloves, creating all the holiday magic. That's the mental load that women are carrying around, making sure that everything gets done.
And your survey of 1,600 parents found some huge gaps in who's handling the day-to-day decisions. So what stood out most to you? And what do those numbers say about those who are carrying the weight at home?
Well, I think there were a couple of things. 8 in 10 women told us that they're the primary decision maker in their household, but also 64% that they said they are handling that day to day, packing the lunches, all of those daily tasks that really just somebody has to do it. It's falling to them. As a result, 34% of women told us they feel overwhelmed every single day. And another third of women told us that they feel that way several times a week. I think that's really concerning because when you think about the care and mental health of our kids who themselves may be struggling, how can we make sure they are in a good place if the people caring for them are really at their breaking point?
And the holidays, they might be over, but a lot of people feel like they're starting the new year already exhausted. What's a couple of practical, doable ways that families can reduce that mental load this week and without turning everything into a fight?
Well, I think it's really important to not do it in those heated moments when you might feel tired or frustrated. Instead, see if you can set aside some time to have the conversation in a very non-judgmental way. Sit down and say, here's everything that we need to get done to have the life we want to have. And then think about who can take which portion of that. That way, it's a conversation and it's something that you can come back to time and time again. It also helps instill some habits. Also be mindful of what works for your family. One of the things that women told us, 41% feel the pressure to be a perfect parent. Women also said that if something goes wrong, it's their responsibility to fix it, and they're the ones who get blamed. That's a big storyline that comes up in All Her Fault, and I think it's why it resonated so much with women. So knowing that those external factors are present and are so strong, that's why it's important to have the conversation of what's right for you and your family. It gives you a touchstone to come back to when you feel those pressures creeping in, and then you'll know this is what we have decided works for us.
And for some of the couples watching, what is one starter conversation you recommend? Maybe something that could help reset expectations without sounding like there's blame or even criticism.
Well, I would say, the easy start is actually maybe not a conversation, but action. One of the things that women told us repeatedly is they don't want their partner to say, how can I help? What can I do? Because then they have the extra load of coming up with a to-do list, making sure that task gets done. Instead, look around, see what you can help with, and just dive right in.
All right. This survey also connects back to the storyline in Peacock's series, All Her Fault. What about that show sparked such a big reaction, and why do you think so many moms saw it in themselves?
I think there are so many moments in this show where women see themselves. It starts in the very first episode when Sarah Snook, the lead character, goes to pick up her son Milo, and he's not at the play date. And people immediately point fingers at her of how could she not know the details of this play date? How could she make this mistake? It is all her fault. There are many other scenes in the show with Dakota Fanning's character of how she is trying to juggle her career and all of the duties for her child, and her partner is just not present. And he just thinks he needs some downtime. Her downtime is shopping and taking care of the house. And so she's not really getting a break at all. And these are themes that probably most moms have had in their friend groups that they're talking about a lot. Women in our survey said that they do turn to friends and family for help a lot, but in third place was the person that they probably should start with is their partner. So make sure you're having the conversations with your partner as well so that you can hopefully create some new habits and a little bit of change in your own household.
Wendy, I want to thank you for joining me today. If this conversation hits home, you got to pull your partner in for a quick, let's say, reset talk, maybe even 10 minutes, and decide who owns a few of the recurring weekly tasks. And if you want to dig deeper into the survey results and the bigger part of the conversation, you can read the USA Today coverage and stream All Her Fault. It's available now on Peacock. Wendy, I want to thank you for joining me today.
Thank you so much.
Have you ever wondered what it's really like inside a plural marriage? TLC's hit series Seeking Sister Wife is back with new stories and familiar faces exploring the ups and downs of polygamous relationships. One of those families is the Davises. Nick, April, and Jennifer are not only preparing to welcome another baby girl, but are also exploring the possibility of adding a longtime family friend as a potential sister wife. Welcome to the show, Nick, April, and Jennifer. How are you?
Hi, doing well, thank you.
Hi, thanks for having us.
All right, for those that are kind of new to the show, can you share a little bit about your journey as a family and kind of what led you to this plural marriage?
Just this unconventional lifestyle is just something that's always appealed to me for quite a while. And thankfully, at whatever point I met April, she kind of fell into it also. She noticed the benefits and recognized it as being something that she wanted to do also. And so we've just been steadily just building together, working on our family. We met Jennifer. Jennifer came along and she was with it too. So the three of us have been together for about 8 years now.
And this season highlights your friendship with Teresa. What made now the right time to explore whether she could be part of your family in a deeper way?
Yes, so this season you will see us courting Teresa. She's been friends with us for over 10 years. And honestly, it was the kind of thing where she approached Jenny and I. She knows that the women in our relationship do the initial seeking. And she made it very known to us that she has feelings for Nick and would like the opportunity to be able to date us and potentially become our sister wife. And so after some correspondence, we decided to go on a date.
And Nick, the show touches on your struggle moving from like best friend to husband. How are you working through that transition?
Oh, wow. It's not easy for me because just the way that I operate in life, I don't like mixing things up. I don't like mixing relationships. So I keep my boundaries very strict. So the time that Teresa has spent as my friend, she's just strictly been my friend, all the way platonic. So to try to move things over now after having so long where her and I were just buddies, if you will, it's definitely something that's not easy for me.
And with the new baby on the way, how does growing your family both add joy and maybe some challenges to this plural lifestyle?
Adding our baby Charlie has definitely, of course, been so overjoying to us. But also, it adds maybe another level of potential complication to adding a potential sister wife. That person is going to need to be okay with, young children and, a newborn in the house. So we want to make sure whoever's coming in is the most comfortable with that and, wants that sort of family lifestyle.
What do you hope viewers take away from your story this season, whether they agree with your choices or not?
Honestly, I think that the biggest thing is that you can have a happy and healthy relationship without it being society's traditionals type of norms. We do things completely different. We even do things a lot of times different than a lot of other polygamous families, and that's okay. And we want to show that you can do things differently and you're happy and have a good family home.
I'm not in any way trying to promote the idea that all men should be polygamous, but you should definitely seek to create the kind of life that you want for yourself. Absolutely.
And do the towels say his and hers and hers?
We definitely should get those. Absolutely.
All right, you three. You can follow the Davis family journey and meet the other families with the new season of Seeking Sister Wife, now playing on TLC. I want to thank you three for joining me this morning.
Thank you, Dan.
Thank you.
You ever have a breakup where the dog took it a little harder than you did? There's a new rom-com that leans into that idea with a very good boy caught in the middle of the world's most awkward co-parenting situation. So today, we're hanging out with Patricia Heaton and David Hunt in the new Prime Video movie Merv, where fixing the dog's broken heart might just spark something between the humans too. Patricia, David, hey, how are you guys doing today?
We're doing great, thank you.
Doing great, thanks.
All right, so for the people that haven't seen the trailer yet, what is the heart of Merv and kind of what pulled you both towards this story?
Well, Merv is about a dog who's depressed because his parents, played by Zooey Deschanel and Charlie Cox, have broken up. And so they're sharing custody of him, and he's not doing well. He's a little depressed. And so it's about their journey to try to help Merv adjust to the situation, and about them mending their relationship.
And the movie treats the dog's perspective with so much humor and warmth. How did that dynamic shape your characters playing the parents?
I'm not sure.
Our characters are really concerned more about the relationship between
we
Anna
played the
and
same
Russ.
sort of role in the sense we're trying to bring the couple back together again.
Yes.
Yeah.
Yeah. So we're a little bit depressed that they're broken up also. We're like Merv. Yeah. So that's kind of our dynamic, and we want to see them get back together.
And there's like a thread of healing throughout the healing through joy that kind of runs throughout the film. And as the parents trying to bring them together, what captured that feeling for you two?
Well, I think, for the Christmas season, it's really important, especially with things that are going on in the world today, to have that kind of joy, to have a reminder to be grateful for your family, to be grateful for your relationships, and try to be kind, just spread kindness in the world. So that's really kind of what attracted us.
Yeah, to be grateful for your own life, as well as that of your family. But it's important to spark a conversation, and if it takes a dog to have people start talking to each other, I think that's a wonderful thing. We could use a lot more of that in the world right now.
And both of you have, I guess, incredible chemistry on screen, because it happens off screen as well. What's it like building this world as a real life couple in a movie and kind of maintaining that chemistry?
Well, how many years have we been married? 35?
Do we have to really tell everybody?
Well, it's just every year on our anniversary, we wake up and we go like, that's enough, right? That's long enough.
Yeah.
There's nothing new to figure out. But I think, chemistry probably brings people together, and then it's about like accepting and creating history together through your family, through your experiences, and then just really appreciating and being able to look back on just sort of this wonderful life that you've been given.
The journey is
the journey.
The journey is everything.
Yeah.
And every holiday movie has that moment that kind of sticks with audiences. What do you hope people walk away with after watching Merv?
I think just, as I said, to learn to be kind, learn to communicate, be patient with each other, give people grace, to figure things out, and just be there for each other.
Can we set aside our differences long enough to actually talk to each other?
Yeah.
That's what I would like people to go away with.
Yeah.
All right. I want to thank you two for joining me this morning. Merv is arriving on Prime Video December 10th. Grab the family, grab the dog. Hopefully they're not depressed, and make sure you stream it right at home. I want to thank you two for joining me today.
Thanks for having us.
Thanks.
Hey, I want to thank you for tuning in to Rise Unwind. If you want to be a part of the show, just go to our website, riseunwindtv.com, fill out the form, send it in. Maybe you could be on a future episode. We're on social media, Facebook and Instagram. Plus, you can find our YouTube channel at Rise Unwind. And until next week, that was the show we like to call Rise and Unwind.